Welcome to our series on improving your hip mobility. My name is Ryan DeWitt. I'm a physical therapist and coach and owner of DeWitt Physical Therapy and CrossFit up in Santa Cruz, California. Today I want to take you through a simple assessment and a couple of really easy self-mobilizations you can do using a band and a lacrosse ball to help improve your hip mobility as it relates to your squat. So let's go ahead and take a look at, see where your hip mobility is starting. We'll apply some interventions, retest, and let's see if we can get your hip moving better right now. So before we start applying interventions to the hip as it relates to our hip mobility for squatting, let's go ahead and talk about the needs of the hip as it relates to squatting. So if I get my squat stance, which we say is about hip width apart in a stance, toes slightly turned out, it's like the pressure relief valve for the hip. What I'm going to do is drop down into a squat. So I'm going to keep my feet flat, I'm going to sit my butt back, my knees are going to press slightly out, chest is going to stay upright, and my spine is going to be straight. I am going to make sure that my hip crease is down just below my knee. And so in order to get down there, my hip needs to be able to go into flexion, abduction, and external rotation. So let's take a look at a couple of quick screens to assess how your hip's ability, or how good is your hip's ability to get into that position. So the first one is what we call this elbow to instep test, also in this Spider-Man position. So we get you down with one leg back, this opposite leg forward. So I'm going to try to put my elbow down to the ground and tap it right here at that instep. If I can do that and I don't have any pain or significant restriction, that's a great test. We'll check the box there. Of course, we're going to go ahead and repeat on the other side and compare side to side. You have two hips, so it's important that we check both sides. So there, I was able to touch, check, check on both sides. The next one, we're going to get you down into this, lying down on your ground. We call this a Faber test, which stands for flexion, abduction, external rotation. So it's a combined motion test. We're going to cross one ankle over that knee, keep your pelvis nice and flat, let that knee fall down to the ground. It should be within about 2 fist widths from the ground, and that shin should be relatively horizontal, maybe about 10 degrees or less. Now if I switch sides, so that right side looked pretty good for me. My left side, on the other hand, this is my stiffer and more painful hip with a lot of my tasks, just from old injuries and whatnot. So this one, that angle is more like 25, 30 degrees. I'm probably about 3.5 fists off the ground on this side. So I'm going to expect to find something in that left hip. So what we'll do is we'll take you through the interventions and then come back and retest these. We're going to start off by treating the soft tissue around the hip with the lacrosse ball. You can also use the tennis ball, it's a little softer, or any kind of mobility ball. There's tons out there on the market. Good old lacrosse ball works very, very well though. All right, the first thing we're going to do is we're going to take that ball, put it down on the ground, put it kind of back here by this back pocket. I'm going to have my hands on the ground, I'm going to bend my right leg, and I'm going to cross my left ankle over that right knee. And now I'm kind of sitting on that ball, on that lateral hip, those gluteal muscles, and I'm allowing gravity to kind of press me down into that ball, taking some pressure off of it with my hands. What I'm going to do is I'm just going to kind of roll around. So what we were looking for is some really tender tissue. It should feel like a massage because it's a hard rubber ball and gravity's pulling me down on top of it. So yeah, it's going to feel a little tender, totally okay, but I don't want it to be necessarily painful. And I want to try to stay on the meat. We have our sacrum here, we have our pelvis here, we got that greater trochanter there. Let's try to stay off the bony stuff and try to stay on the meat. So I'd spend about a minute or so, and you can spend a little longer if you want, but again, this shouldn't really make you it shouldn't be super painful, it should just be tender. So if it's too painful, then go ahead and just go lighter. So like I said, about a minute or so there on each side. So now that we've used the lacrosse ball to soften up the tissue in that lateral hip, we're going to go ahead and stretch the hip with a mobility band. So this is a 1 1/8 inch super loop, and we have it securely anchored here with a carabiner. As long as it's around something that's really stable, it's not going to break, it's not going to pull over, we're in good shape. If you wanted to use a lighter band for less pull, like less of a strenuous mobilization, we can use a smaller band. If you prefer stronger mobilization, we can even use a thicker band. There's different varieties out there. First thing we're going to do is go ahead and take our foot and slide it through. And we're going to bring this band all the way up into that hip crease. What I'm going to do is I'm going to step out, and then I'm going to get back into this kind of pigeon position. So I'm going to put my knee down and kind of cross my ankle forward here. That band is going to be pulling kind of back at like a 45-degree angle. and I'm just going to sit back and down into that hip. I can move around a little bit and just see if I can get a little extra stretch. This band is trying to take that femoral head and kind of pull it back in the socket just a little bit, so I shouldn't be getting any pinching. I should only get a stretch. If you're not sure if you're appropriate for this, and really the people that we'd worry about is, please, if you've had a hip replacement, please talk to your therapist before you even consider doing this. And everybody else, if you're not sure, or if you're getting any kind of pain with any of the things we're suggesting, please talk to a therapist first, a PT first. So we'll start here with this pigeon. We'll spend about 30 seconds to a minute there. And then from here, we'll just kind of flow right into this Spider-Man position again. So just that same test position. And for starters, I'm just going to take my left hand and press on my left knee and just kind of press it out. So as I do that, I get a big stretch through here, and that band is pulling me back, and I can press myself out like 8 or 10 times, which I won't do all of those now. And then I can also go down and try to drive that elbow down to that instep and then rotate up. The rotation is actually just because it feels good, and it kind of gives you a second to give the hip a break. But my goal before I stretch is to essentially be able to get that elbow comfortably down to my instep, which is, again, this is my stiff hip. So if I can get my elbow down, I know that I have the requisite range of motion, and I always end up feeling better during the workout and after. So I'd go another 10 like that and see how it feels. From here, I want to now kind of test that hip out and see how it feels. So what I can do is, let's get back into our first test position, and let's see, can I get that elbow more comfortably down to that instep? And again, I was able to do it before, but it was a little bit of a stretch for me. I could feel it, but it got down there a little bit more easily, which is great. Next thing we want to do is just test that squat and see, does it feel any better? And you know what? I only mobilized my left leg for the purpose of this video. This hip feels way better than this one does right now. That's great. That means this stuff works. So what I'd like you to try to do is go through just these 3 simple moves. Give yourself the 2 assessments, and then go through the lacrosse ball and the glute. Let's go for a pigeon stretch, and then that like Spider-Man hip distraction stretch. If you have a band to add towards it, great, go for it. None of this stuff should be painful. And then retest yourself. Try that elbow to instep. Retest that Faber position. That one may be a little harder to monitor. The elbow to instep is a lot easier to say, like, yes, I touched it, or no, I didn't. And then see how your squat feels afterwards. Keep in mind, if you're not able to touch your elbow down to your instep, and that Faber position isn't totally perfect like I described, it may not mean that you have a terrible squat. It just may mean that if you're trying to look to improve your squat, that these are some really simple tests to assess, like, do you have that basic mobility? And if you just work on that basic mobility in that hip, chances are you'll make some big improvements with some very simple interventions. So if you'd like for us to take a look at your squat, go ahead and reach out to our office. We're here to help you feel, move, and perform better.